2021 regular business meeting of Waynesboro City Council. Just a few housekeeping things. If you wish to participate in the citizen comment period, we've got an 844 number for you to call. The number is 844-9200. When you are prompted, you will enter the code 398145 followed by the pound sign. You will hear question and answer period has started. At that time, press the star followed by the number 6. You will hear if you would like to speak, press 1 to be added to the queue. At that time, press 1. While you're in queue, you'll hear the audio feed of the meeting, and you can sit back and listen. When it's your time to speak, you will be prompted by the moderator to share your comments with City Council. And just a reminder that those wishing to make comment, we have a 4-minute time period for you to make your comment. So if you could keep it within that 4 minutes, we greatly appreciate it. With that, brings us to item number 2. Item number 2 is to adopt the meeting agenda. Is there a motion to adopt the meeting agenda?
So moved.
Thank you, Dr. Hossetter. Do we have a second?
I'll second that.
Thank you, Mr. Allen. Any discussion? All in favor, say aye and raise your hand. Aye.
Aye.
This motion carries. Any opposed? Forgot what little thing. Here, no opposed. This motion carries 5-0. Item number 3 is the consent agenda. We've got a small change to the consent agenda. Waynesboro Public Schools have requested to withdraw items 3G and 3I for consideration. With that in mind, do we have a motion? Pardon me? Oh, somebody's background, okay.
Yeah.
All right, with that in mind, can I get a motion to approve the consent agenda minus items 3G and 3I?
So moved.
Thank you, Mr. Short. Do we have a second?
I'll second that.
Thank you, Mr. Allen. Any discussion? All in favor, say aye in a show of hands. Aye.
Aye.
Any opposed? Motion carries 5-0. Thank you all. The next brings us to item number 4, which is matters from the mayor. I got a couple of things tonight that I wanted to go over. One is to let all the citizens know we heard the comment period last week about the regional jail. Right now, we've not made any decision on the regional jail. We're not in the process of making any decision. We're still collecting data, and we will push this out until we have all the data we need in order to bring it forward to the city again. And the next matter is we've got a couple of service awards that were passed out over the week. Waynesboro Police Department passed out 12 awards, and lucky for me, 8 of those I've had the pleasure of working with, and these are all service-related awards. Sergeant Paul Harris got a 5-year service award. Corporal Ian Warren got a 5-year service award, and Corporal Jesse Fazell got a 10-year service award. And now these next awards are going to be 15 years or more, and these guys and gals are really to be congratulated on their time of service with Waynesboro. Officer David Lehman, 15 years. Officer Ben Lemon, 15 years. Sergeant Fred Smith, 25 years. Captain J.W. Oliver, 35 years. Captain Becky Meeks, 30 years. Captain Kelly Walker, retired, 35 years. And Officer Walter Wallace with 35 years. Also, Corporal Todd Armentrout was awarded a 20-year service pin, and Operations Technician Michelle Farrell was given a 5-year service pin. So thank you all for your service to the city. We appreciate all you do for us and protect us. We also had some awards that went out to the Public Works Department, and Mr. Shaw is going to share those names.
Sure, thank you, Mr. Mayor. In terms of service awards, 5-year service awards were given to Noah Cardeman, who works in the Streets Division, Brandon Hewitt, who's worked in streets, refuse, and sewer, Matt Nicely, who's a signal technician who keeps the lights going here in Waynesboro, as they say, Tony Smith, who's an engineering tech, and Derek Snyder, who works in the Water Division, all received 5-year pins. Todd Wood, the city engineer, received a 10-year pin. Several people received 20-year service pins. Chris Lowry, who works in the Streets and Stormwater Division, Charles Rhodes, who is a mechanic in the Fleet Division, and Dwayne Schwartz, who has been started here on a water crew and is now the city's water treatment plant operator, chief operator. For 25-year service awards, David Adcock, who leads one of the concrete crews, Chuck Connor, who's a lot of folks know Chuck, who works up at the recycling center, real helpful guy. He's been in the streets crews and the refuse and recycling during his tenure. Lisa Osteen, who does recycling, special projects, and heads up safety training programs in public works. Mark Sondrel, who's been a supervisor and superintendent in the sewer division and now heads up the fleet division. For a 30-year service pin, Steve Wright, who has been worked actually in a couple of different areas of the cities, worked in public works and parks and recreation, and he's a utility locator for the city. Every year, Public Works for many years has given out service awards for employees, recognizing employees of the year in the various divisions of Public Works. And I think these are especially meaningful that the folks that are given these awards are nominated by their coworkers and supervisors, and then there's a group of supervisors and crew members and general staff who get together and decide, based on the nominations that are turned in, who gets the awards. And I believe, Mr. Mayor, they may have even solicited your help in trying to determine the Public Works Employee of the Year. So the Fleet Division Employee of the Year is Zach Almerode. Water Division Employee of the Year is Michael Helmick. The Streets Division actually had 2 co-employees of the year, Andrew Ratliff, who's worked with the city more than 30 years, a great guy, a great attitude, a real asset to us. And then as well, Chris Lowry, who's got more than 20 years of service with the city. Both are Streets Division co-employees of the year. Sewer Division Employee of the Year is Brandon Hewitt. The Treatment Plants Division Employee of the Year is Seth Bates. Refuse Division Employee of the Year, Adrian Terrell. Public Works Admin Employee of the Year is Chris Garrison, and the Public Works Operations Division Employee of the Year is Josh Burrows, who's a superintendent of the refuse crew. And the Employee of the Year this year in Public Works is Chris Garrison. And Chris is a fellow who is a mapping technician. He's been instrumental, really, in developing the use of geographic information system software as applied to really all of the divisions of Public Works. That we have maps now of everything from water and sewer lines to the location of stormwater assets and so forth. And Chris was really instrumental in helping to use those technologies, even to assist with our compliance with the MS4 regulations, the federal regulations that govern our stormwater system. And you may recall that in the past year we talked about a national award that the city received from one of our software vendors for our innovative use of the cartograph software to basically track the volumes of grit and sediment that we collect off of our streets, and that information is reported to the Virginia Department of Environmental Quality and ultimately to the EPA as a regulatory requirement based on the national stormwater permit that we hold. So, Mr. Mayor, we congratulate all those folks for their good work and service, and especially a big shout out to Chris Garrison.
Thank you, Mr. Shaw. And I do want to say that I had the opportunity to go over during that awards ceremony and listen to these folks talk about their job. You don't think about public works as people really loving what they do, but these folks have a passion for what they do, and they really talked up what they did. I appreciate all their hard work and all they do. So thank you all in public works.
Mr. Mayor, I almost missed two folks. I apologize. That they give a Goodwill Award in Public Works, and this year it actually went to two folks who went to the assistance of a pedestrian who was injured this year, and they came across that individual and rendered first aid and kept them calm until the rescue squad could arrive. And those two individuals receiving the Public Works Goodwill Awards were Victoria Washington and Dewey Lehman.
Thank you very much. All right. That brings us to item number 5, which is matters from council. Anybody have something they want to share from council? Dr. Hofstadter's unmuted, so he's ready.
All right. Well, today I'm going to actually defer. I usually try to give a coronavirus update, but today we have someone who has more knowledge and more information. Dr. Nagy from the health department will be talking later, so I will defer to her. I would say, from what I'm seeing, the good news is our numbers have started tracking down after the spike after the holidays. So hopefully we will see that trend continue, but I'll be interested to see what she has to say, and I know she'll be hopefully talking about vaccine access and things like that, which I'm very interested to hear as well.
Thank you, Dr. Hofstadter. Anyone else have anything? Nope.
Mr. Mayor, I just want to add I think a neat story that I had the privilege of spending several hours with some middle school 8th graders last week in all of the civics classes. They were all through Zoom, so just like we're doing now, so about 80 or 90 kids. And I've had the privilege of doing that for about 4 years, basically kind of covering civics, local government 101. And I would share that the first year that I did it, I had a really neat experience that I thought the group might sort of get a kick out of. That I ran into a student who was a cashier who said, "Well, you look awfully familiar," and I couldn't place them. And they shared that they were once an 8th grader over there and heard my first spiel on civics and the importance of showing up for civic life and local government and participating in our democracy. And she shared that her mom she actually convinced her mom when she was an 8th grader to go register to vote as a result of that. It was just really cool. But I would also want to share just how proud I am, not just as a dad, but as to have this chance to serve our community in this capacity, and how I have seen with my own eyes how the responses, and I give this sort of opportunity towards the end of the lecture for folks to chime in of, if you were the king or queen of Waynesboro, what's the one thing that you think we need? And I have seen, not that, Olive Gardens are always the bad answers, but those first years, it was Olive Gardens and it was donut shops and everything. But I really wanted to share with folks that our school system and I think our community is just evolving in a way. The responses that I've gotten over the years, and was just really struck me this past week, is so encouraging. They talked about the need to support our homeless population, the need to not one Olive Garden request, the need to support pay for our employees. These were coming out of the mouths of children, and I just thought it was just the neatest thing. It really gave, I think, a bright light to not only the families in our community, but our school division, all operating in a really difficult environment with COVID and distant virtual learning, but was so inspired by so many of the comments, and I thought I'd share that with the group this evening.
Thank you, Terry. Thank you very much. All right, that brings us to item number 6. Item 6 is to receive information from Dr. Laura Carnegie Director of the Central Shenandoah Health District regarding the coronavirus public health emergency and the COVID-19 vaccination process. I turn the floor over to you, Doctor.
Great. Thank you guys so much for having me. It's really hard to believe we're coming up on like the 1 year anniversary of the pandemic. It's been a really long year for everyone, but we've really appreciated, all the collaboration of really all of our community partners at every level, to kind of make it to this point. As Dr. Hostetter said, the good news is that since, our spike, really following Thanksgiving break, which was basically almost a 90-degree upward line in our epidemic curve, we've finally seen, that trend going downwards, and we hope that it continues to be a trend. We've been able to, in that period, hire on quite a few more contractors, and I'm happy to say that for the first time in probably the last 11 to 12 months, I've been able to free up my public health nurses to kind of pivot towards 100% concentration on our vaccine efforts. So that's been really, really important. Along with the decrease in cases, the other really good news is that we have, really safe and effective vaccines. We have the Pfizer and the Moderna vaccine. They're both the messenger RNA vaccines, have efficacy of above 95%. So we've been able to start our vaccine efforts, started back in Christmas week, I think, with Gary and his EMS crew. We're amongst the first 1A healthcare providers to kind of get vaccines, and we've kind of rolled on from there. I think the one thing, if I had a wish, is that we'd have more vaccine inventory. As with any program, we started, worked our way up, built a lot of community capacity in order to really do high volume vaccines. But unfortunately, the vaccine volume is just not there. Amongst our community capacity to vaccinate, I think our EMS vaccinator program is really important, and that's helped us really over the last 5 years. I have a terrific emergency planner in my district who came from strong EMS backgrounds and really kind of got that program started about 5 years ago, and we've been able to work with the EMS community as vaccinators, so they're going to be an important part, and they have been an important part of our efforts going forward. The other great community partner that we have in Stanton, Augusta, Waynesboro is Augusta Health. They've been right there with us, through the entire COVID response, and really have stepped up and made a huge commitment for vaccine response. If you haven't been over to see their operation, it's really impressive. They set up their gymnasium, basically their fitness center, as the COVID vaccine distribution point. They're committed to continuing with COVID vaccine through the end of this calendar year, which hopefully will get us, beyond this pandemic. And they have enough capacity, and they've made enough commitment to that they'll be able to provide up to 6,000 vaccines per week. We just need to have that vaccine available, to feed to their operation. At this point, the vaccine distributions are severely limited. Kind of the way the distributions began was with healthcare systems. And that kind of made sense because our first priority group were those 1A healthcare workers. The healthcare systems, at the same time when they were taxed with giving out vaccines, a lot of them, Augusta Health included, were also short-staffed, had a lot of beds filled in their hospital with people with COVID. So a lot of health systems throughout the state found it very challenging to continue with vaccine distribution. the vaccines got a little bit stalled in our healthcare system. And, a couple of, months or so ago, we kind of had to pivot to figure out where the vaccine, holdup was, kind of redistribute vaccines and get them out. We've been able to, as a state, I think, do that really effectively. You go back about a month ago, and in the, some of the newspapers that kind of rank states as they're doing, Virginia was 49th or 50th. And that's not the place that we want to be. We knew we could do better than that. So the governor tapped one of my colleagues, Dr. Danny Avula, to be the vaccine coordinator at the state level, kind of get things moving along. And I think that was an excellent choice. Danny brings like over a decade of experience as a health director, so he really has that local vision. He knows kind of the issues at the local side, but he's also, able to get things done at the state side. So with him and a little bit of effort, kind of redirecting vaccines, Virginia's up to now about 10th in the nation in terms of number of vaccines distributed versus number of vaccines in arms. So we're doing much better. The one thing, like I said, that we do need is more vaccine. Beginning a couple of weeks ago, the state, which receives all of the federal allocations of vaccine, decided that the best place to put the vaccine would be directly with the health districts and have the health districts figure out kind of how best to get that out into the community. So for our health district, we have 10 localities or about 2,500 square miles. We big health district. We get about 3,450 vaccines total per week to distribute amongst all of our entities. At the state level, we're getting about 105,000 vaccines a week to distribute throughout the state. The state made the decision that probably the most equitable way to do that distribution would just be by population. So we have about 300,000 people. You divide that up by the population, we're about 3 to 4% of the population. So get approximately 3 to 4% of that total allocation. So we've retained some of the vaccines to do large pod clinics. We've shared vaccine with Augusta Health. We've shared vaccine and pods with Centera Health System. We've shared vaccine with Carillion Health System down in the south. We've also shared with some of our federally qualified health centers. We have 3 throughout the district in Harrisonburg, Lexington, and Highland. And they've been good community partners in trying to get things out and about. But 3,450 vaccines, doesn't slice up that broadly. We've been trying to get it, like I said, kind of out, throughout the district to meet all of those needs. Currently, the folks that we've served include the 1A healthcare worker population, and I don't think we've reached 100% of them yet, but we've taken a good first swath of that group. And now we're entering into that 1B phase, which is other essential workers. We're really only going to be able to hit the top 3 tiers of that 1B phase until we get more vaccine, and that would be fire, rescue, and hazmat, homeless populations, jail populations, and migrant workers, and then the third, K through 12 education and child care providers. We've been working over the last 2 weeks on our K through 12 public education, and we really kind of took our show on the road. So we've been going out to all of the school districts and doing vaccine clinics on site. We've done that in collaboration with school health nurses and in collaboration with local emergency management and EMS. And it's gone beautifully. Everybody has nothing but good things to say about those efforts. And I think that the great part of these vaccine efforts, particularly for my staff, which is a little tired, after a year of emergency response, is that the vaccine efforts are so uplifting. People are so grateful to get the vaccine. They see this as what it is the light at the end of the tunnel to getting more towards normalcy. So, it's been a lot of hard work, but, really, really good and meaningful work. We're hopeful that we'll see some additional vaccine in the coming weeks. President Biden promised about a 16% increase in federal allocations, so hopefully we'll see that coming soon. The other big population that we've been able to take care of too, using a different federal program, is our residents in long-term care facilities, assisted living facilities, and group homes. You know, these are all of our folks. A lot of them are older. A lot of them have chronic medical issues. A lot of them have really borne the brunt of morbidity and mortality related to COVID-19. So we're really trying hard to cast a wide net for all those folks. For skilled nursing facilities and assisted living facilities, there's been a federal partnership with CVS and Walgreens, and they've been able to, they've done all of the skilled nursing facilities. There's 18 in our district. They've all gotten first shots, and most of them have already gotten second shots. So that's been real great to see. Still working some on assisted living facilities, and then we have over 140 group homes that are generally pretty small. The average number of folks in those homes is, you know, about 5 or so. But again, they tend to be some of our higher risk folks. So we're again kind of taking our show on the road, trying to get, you know, all of those folks done as quickly as possible. And some of our pharmacy partners are helping with that as well. I think I'm really pleased. I know at a district perspective at, you know, what my team's been able to build in terms of capacity and efficiency with working with the vaccine. And I think, you know, as the inventory becomes better, we'll kind of be a well-oiled machine and be able to, you know, get it out along with all of our community partners. So that's been a good thing. I think Mr. Hamp is probably going to talk next about the, our local government agreements and funding for public health. And I think if there's any, you know, kind of bright spots to a global pandemic, one is we've been really showered with money in public health that we generally have not had in years past. I think one of the things that, you know, a pandemic and a prolonged public health emergency points out is kind of the gap in some of our public health infrastructure that haven't been addressed in previous years. So with this emergency has come a lot of money, and I think it's not only going to allow us to respond to the current public health crisis, but also put things in place that will help us going forward. So some of the money that we're getting from the federal government for epidemiology programs will include robust enough funding that we can, you know, improve our IT infrastructure. You know, a lot of the databases that we use to gather information are pretty antiquated. So being able to improve things like that will not only help with our ongoing response to the pandemic, but also help us, you know, be well placed in the future to kind of get up to that 21st century level of technology that'll help us to just do our jobs better. So again, you know, it's been a tough year, but some good things have come of it. I think one of the particularly good things is being able to work incredibly closely with, you know, all of our community partners. I think Gary Kreitzer and I are like best buds at this point. We talk frequently, and, you know, being able to strengthen those relationships in the localities has been a really good thing, because my boss, who's a really smart guy, he always says, you know, the time you want to make friends is, you know, before something bad happens. So being able to build on those friendships and those connections, you know, helps us do, you know, all of our work better in the future. So, you know, some good things come out of bad things as well. I'd be happy to take any questions you guys may have.
Anyone want to ask a question? Dr. Sam is unmuted, so I'm ready. He's ready.
Thank you so much for your presentation, Dr. Kennedy. The question I've got comes from both experience with my patients, but then also talking to community members. I know that the Central Shenandoah Health District website has a questionnaire to sign up and sort of get on the list. And there's also a phone number, and hopefully we can share those in our minutes for folks. What is the process then? Because I've had some patients that said they don't know when they're going to hear something, and I've had other patients that said, "Oh yeah, I got a phone call 5 days later, and I've had my shot." So how does that work at this point?
Sure, and I think that's something that we've gotten organized over the last few weeks. I think our entrance into 1B kind of accelerated a lot quicker than either the district or the state anticipated. So we honestly had to scramble a little bit to figure out registration systems for individuals. It's easy enough to meet, large groupages, healthcare workers and EMS, that kind of thing. On the individual side, a little tougher. So we have registration tools, on our website that we've been using to essentially form a waiting list. And we've got a couple of registration tools up there. We've got, for folks greater than age 65. We've got for employers who can register, their employee groups. And then we put one up recently for the 16 to 64 with chronic medical conditions, which is another group that we're trying to reach. And essentially what we try to do is kind of take those registrations basically in order that they're received, but also a little bit by area. We're trying to, take the small pot of vaccine that we have and make sure that it gets sprinkled around this large district. We just don't want it in one place. So, basically, separating out those waiting lists by, a little bit by where people live, but mostly by the time that they register. One of the things that the state is standing up is basically, and it should look seamless from the consumer end, is a similar registration tool statewide. So instead of having 35 different tools in 35 different districts, having one on the state website, that people can clearly go to, and they're going to be able to feed our data, by timestamp into that. So it should just add on to our waiting list over the course of time. But I think having that one tool, and especially having it on the state website, is going to make things a little easier. The other thing that they're going to be standing up, and this should probably be ready to go in the next few days, is a large volume state call center. They're hiring about 750 or so operators, mainly to help people with questions related to where do I get my vaccine and how do I register. Unfortunately, with the wait list that we have now, you get an acknowledgement back that we received your email, but the next communication you're going to get from us is when, it's a registration link for a vaccine clinic opportunity. We can't really tell people sort of, that we could tell them that we have, 30,000 people and their number, such and so, but I don't think that gives them much of an idea about, when they're going to be invited to a clinic. So I know that lack of communication, we get emails back all the time. We call through the system constantly because I think people feel like if they don't hear back in a week or so that it probably didn't take. So, kind of, multiple entries for the same vaccine from the same people. So we're trying to, kind of work through all the groups. We try to give a general idea in our newsletter and on our website, kind of the groups that we've taken care of, what we're doing the week to come, and in general, when you could expect to get called for a vaccine. But it's very variable at this point. When you add up all of the 1B folks plus the 1A, that's probably about half of our district population. That's probably around 150,000 people, in total. So it's just going to take a while to get through those groups. Essentially, what the governor tasked us with doing, and I think it's a pretty good framework to operate under, is to use about half of our vaccine for the greater than 65-year-olds, and that makes sense. Age is a real risk factor. And then the other half to divide it up, somewhat equitably between those top tier of the 1B. And like I said, by and large, at this point, that represents education and child care sectors, homeless populations, jail populations, and migrant workers, and the 16 to 64-year-olds with chronic medical issues. So kind of trying to separate out, and reach all of those groups. And of course, public health has always been all about equity, and the other groups that we really want to, make sure are not left behind, are persons of color, vulnerable populations, et cetera. We've been able to do some nice outreach with, especially with Augusta Health. We went and did Gypsy Hill Apartments, which is kind of low-income senior apartments in Stanton, and we're kind of trying to work through, lists of, older folks who, may have a hard time getting to clinic opportunities. We're working right now with some of our migrant labor camps, and we're going to do we have a couple of Spanish-speaking healthcare workers who will be able to kind of lay the groundwork for efforts with those groups. What they want to do is get in there and do some education about the safety and efficacy of the vaccine, but also about the fact that, your citizenship or lack of citizenship or concerns along those lines don't matter. We'll be here. Hopefully you'll want the vaccine. We'll come back and, get on site to get vaccines to some of those vulnerable populations. Likewise, we've been working with the warm shelter folks, with Mission, Valley Mission folks to try to get some of our homeless populations on. And working to try to get, like I said, reach our most vulnerable sectors. And my only wish, as I said before, is that I had more vaccine to reach more people at this point.
Thank you. That answers a lot of questions and I think puts it in perspective, because I've talked to a lot of folks, who aren't sure where things stand, but knowing that the whole district gets 3,450 vaccines a week, clearly the hose isn't turned on the whole way yet. If you can make available to us what that website or how the state link, once that is up and running, if you could just send something through Gary or somebody so that we can access that and share it with constituents, and in my case, with patients, that would be great, because, whatever the system is that works best, we want to be able to get the word out.
Yeah, no, I'd be really happy to do that. That's no problem at all. And we're trying to reserve some of our phone capacity for folks who, maybe don't have internet or can't, navigate a computer. So we do have a survey tool that my staff can fill out, for folks. So, encourage, patients who need that service to call us, or the central call center will also be able to help with that. And we just stood up a Spanish language survey, which I'm really happy about. Sometimes it takes a little while to get things translated, but we have that available, which I think is important for this area as well.
Thank you again.
What is the population in our district?
300,000 people.
Okay. Thank you, ma'am.
Sure.
Anyone else have questions for the doctor? All right. That was good information. Thank you very much, but don't go too far. I think you're going to be doing another presentation here in just a minute.
All right.
Item number 7, to receive information to consider a motion approving the local government agreement between the City of Waynesboro and the Waynesboro East Augusta Health Department. Mr. Ham.
Yes, sir. Mr. Mayor, members of council, The Central Shenandoah Health District runs from Rockingham to Rockbridge and west to Bath and Highland, and the eastern boundary is Augusta County. But the relationship that we are most concerned about is the relationship between the city of Waynesboro and the Waynesboro East Augusta Health Department, which is a member of that district. That relationship, according to the Code of Virginia, is defined specifically through a local government agreement. And each year, the council is required to consider and approve the local government agreement. That agreement specifies financial responsibility on the part of the Commonwealth and financial commitment on the part of the locality. It discusses whose employees are whose and who's responsible for insuring those employees. But I think more informatively and more importantly, the agreement discusses the services and programs that are to be delivered by the health department. And that's attachment 1A. It's rather an extensive list, but with the good fortune of having Dr. Cornegie with us this evening, I thought it might be helpful and even more informative to have her identify either programs and services of particular emphasis or programs and services that perhaps the community isn't always as familiar with as perhaps that we need to be. And again, I think Dr. Cornegie's point about the occasion of the pandemic, while enormously challenging, raises the profile of the importance of public health in local communities and the importance of the health department. So, Dr. Cornegie, if you would like to hit the highlights among the services and programs or keynotes in that regard, according to your judgment, we'd appreciate it.
Sure, no, I'd be happy to. And, one of the flagship programs really for public health is vaccines, vaccine preventable diseases and vaccines to prevent those diseases have been really one of the great public health achievements, of the last century. So we provide vaccines for children, vaccines for adults. We're continuing to try to fulfill that role within our communities, particularly for childhood vaccines, which a lot of kids with the COVID pandemic have really gotten off schedule with those important vaccines. So that's one of our, really flagship clinical services. In addition to that, we receive funding for family planning, for Title X family planning. So in our Waynesboro office, have family planning clinics. We work with HIV needs in terms of medication assistance for HIV and Ryan White services. We are in charge of tuberculosis programs, which luckily we have a low burden of TB, but a very important program, throughout the district. Rabies is another kind of common infectious disease that public health deals with. Subject matter expertise in terms of animal bites, following up on animal bites, and then providing post-exposure prophylaxis for folks related to rabies. We house the Women, Infant, and Children's Supplemental Nutrition Program, or WIC, which provides nutrition assistance to pregnant women, postpartum women, children under the age of 5. In our district, we started about 4 years ago a farmers market program in our Stanton office, which we're hoping to expand, but it uses vouchers that we give to WIC clients, and they can get fresh produce. So we have a farmers market in the Stanton Health Department in the parking lot every Friday, and folks can redeem their coupons for fresh produce. We have actually the highest redemption rate of any district in the state. I think because we brought the farmers market to them, so we're really, really proud of that program. Environmental health does restaurant inspections, hotel inspections, pool inspections. They do things related to septic and well permitting. Most recently, they've been really active for enforcement of the governor's executive orders related to COVID mitigation, including mask wearing and sizes of gatherings. They've been over probably the last 6 months, kind of our central complaints departments for executive order enforcement. So those are some of the major programs that we house, in public health. We'll be really happy to get back to them and get our focus off of just COVID. I think some of the programs that we started over the last year, which I'm sad to say have lost a little bit of traction. One is an emphasis on our addiction crisis. And we've been doing Narcan training, Narcan dispensing, and I think had really gained some good ground until the pandemic hit. And between the toll that has taken on mental health and the decreased capacity that we have to continue to do that good work, it's been a negative for a lot of communities. So I'm hopeful that we can free up some more time to get attention to that, that important problem. Another issue that we've been working with specifically in Waynesboro was with the teen pregnancy rate, which was higher than most places within our district. And we got some funding from Augusta Health to hire an on-site community health worker at the high school, and she did some great work, got some great programming started. We also started a program with the high school where we can provide birth control options on site. So we'll see the teens and a teen clinic at Waynesboro that they would be able to pick up their birth control options kind of at school. So that kind of removes the issue in terms of transportation. That can be sometimes a barrier for teens. We've been able to continue that clinic, which has been nice via just telehealth. And teens actually, I think some of them may prefer the telehealth method. They're always on their phones anyway. So that's been a program that we've been able to continue to nurture and grow. Unfortunately, we lost our community health worker at the end of the summertime. So we're hopeful to get somebody back in the schools again. And we really found that, having somebody on site in the schools was able to make a great connection. And I think in addition to, issues related to sexual health and birth control, mental health was a big issue as well. And she was able to identify, issues there and connect kids up to needed care. So I'm hopeful that, as we open up a little more time and get past this pandemic, that we can grow on some of those good programs that we started within the Waynesboro community. The other thing that I think we worked on over this last year, specifically in Waynesboro, was a walkability grant. And I haven't been back by the high school recently, but I know they created some, I think some great artwork and crosswalks in order to, kind of increase walkability in the around the school. So that was kind of a neat project as well. So. Like I said, we'll be really happy to be able to open up our spectrum of services, well beyond, just emergency and pandemic services in the months going forward.
Thank you, Doctor. Are there any questions for Mr. Hamp or the doctor? All right, hearing none. I'll open up. Do we have a motion to approve the local agreement between the City of Waynesboro and Waynesboro East Augusta Health Department?
I'll make that motion. I'll second.
Thank you, Mr. Allen. Thank you, Mr. Short. We have a first and second. Any discussion? All right. All in favor, say aye and share your hand.
Aye.
Any opposed? The motion carries 5-0. Thank you all very much. Thank you, Dr. Courtney, for being with us tonight and giving us the information you gave us.
Of course, and thank you for, both, all the support, financial and otherwise. We really appreciate it.
Yes, ma'am. All right, we move on to item number 8 now. Item number 8 is to receive an update on city economic development activities. Greg Hitchen, Director of Economic Development and Tourism, will give us a briefing, and there he is. It's all yours, Greg.
Good evening. Thank you, Mr. Mayor, members of council. Go ahead and share my screen here. Great. Thank you for the opportunity to give you this update on what we're doing on economic development and tourism. You know, if you've heard me talk before, you know that we work in seven key areas of strategy. We're not going to talk about all those tonight, but many of the things that we do often intertwine between different layers of strategy. So I do want to talk about two of those tonight. So we're going to focus in on two of those, and that is small business and communications or marketing. So tonight, we're all going to talk about our small business efforts and a lot about our COVID response and the CARES funds and how that fits in to our small business efforts. Talk about some business attraction marketing. And we're going to cover a lot of things tonight. I'm going to make reference to several things. So at the very end of the presentation, I'm going to show you a QR code and a link to a website. So get your cameras ready. At the very last slide, take a picture of the QR code, and I'll take you to a website that'll give you some additional information, a lot of videos that we've taken for different purposes. I'm not going to take the time tonight to show those. You can look at those at your leisure. So please be ready for that. As already been mentioned, about 10, 11 months ago, we made a huge right turn or left turn in things that we were doing. And as we looked at that now, we decided first we need to jump in with relief efforts, but we need to quickly move from relief to recovery. And we're going to talk some about that tonight. But just to refresh our memories a little bit about what we did on the relief side. Almost immediately, the EDA jumped in with an emergency loan program, basically liquidated any funds that were in the revolving loan fund to short-term, small amount of emergency loans to area businesses. At the same time, we also deferred payments for any outstanding existing loans that we had. So that was, we deferred the payments for 3 or 4 months. Everyone's back on track now. I'm glad to say that everyone's current out of these programs. We also did a business survey, a business needs assessment survey. Started off by doing direct mail to make sure everyone knew about this, opportunity to take a survey online. We increased or made much more visible communications portal on our economic development website, tied in with the city's website. They were linked back and forth to make sure that everyone could easily find information that they needed to find about COVID, the relief, the recovery, everything that was going on, all the information, the executive orders, that sort of thing. We joined forces with our regional partners. So 23 of us got together on weekly phone calls to discuss what we were doing individually, how we could share our responsibilities, how we could share best practices, and really help each other get through this. A couple of key outcomes of that, we passed the hat, we purchased enough PPE material to put together 100 kits and gave those out free to business on a first come, first served basis. We developed a how to start up your business document, put that on the website. Created We Are Open signs, any number of different things that we put together to help businesses get up and running. And last, and certainly not least, was you. City Council recognized the need and the opportunity to help our local businesses by providing grants. When the state funding became available and the definition of that funding became obvious that we could use that money for small businesses, you all jumped right in and provided that opportunity for our businesses. We created 4 programs between July 1st to December 31st. The Renaissance Fund, Sustainability Fund, which was strictly for nonprofits, expanded on the original Renaissance Fund with Renaissance Fund 2, and last but certainly not least, the Alfresco Dining Grant Program in December. All told, we gave out 68 grants to 53 companies, which really impacted 372 employees. And we're going to dive into those numbers a little bit deeper. First, we mentioned that we wanted to make sure that everyone possible knew about this. So we cast the broadcast far and wide through our internal newsletters, through city newsletters, websites, social media. The press picked up 2 media releases, and 2 direct mails. To everyone had a business license in the city of Waynesboro got a letter from us twice, talking about things that we could do for them and help them to take the survey and take advantage of the grant programs, etc. Here's how the four grant programs broke out. $131,000 for the first one, $76,000 to nonprofits. The big one, which was the Renaissance Fund on steroids, $386,000. And then finally, the Alfresco Dining Grant for just over $6,000. All told, it's $600,000 that you funneled into small business to help them sustain their efforts, which was 15%, by the way, 15% of your total allocation from the state. What were those funds used for? Well, 46% of those were literally to keep the lights on and keep the doors open when they could open them. So rent and utilities are the 2 biggest factors of this. As we go around clockwise, we allowed some of the grant fund to be used for payroll, very little of that because most of that was covered by the federal programs, PPP and the EIDL grants. We allowed some monthly payments for business type debt that was occurred during the March to June timeframe. Nonprofits were allowed to recover actual expenses for canceled events. 10% of the money went for safety equipment, masks, gloves, all that type of information. 9% went for e-commerce, so how to computers and printers and that sort of thing to get small businesses set up to do business online rather than have people walk through the front door. And then 23% inventory, equipment, and supplies. That's kind of a catch-all category. That includes everything from packets of ketchup to HVAC equipment, but it's, again, inventory, equipment, and supplies. So we allowed companies to purchase some inventory. The business has been closed for 2 or 3 months. They have nothing to sell. So we allowed them to buy some inventory so they would have something to sell when they open the door. And again, equipment and other supplies to keep their business running. The employee count. So we have basically 36, 37 companies have between 1 and 5 employees. That number stayed consistent from March until August. What I thought was interesting is the next 2 graphs where in March we had 3 companies that had 6 to 10 employees, but 5 companies that had between 11 and 20. Well, that kind of reversed as time went on. So we did lose some employment. That's what that graph tells me. We lost some employment during this, but we didn't really lose that much. What type of businesses? All types. Retail was the big at 23%, and you can certainly see this as you go around the horn. 17% of the I guess was nonprofit, but we really covered all types of industry through this program. SWAM, which is small women and minority businesses. We have a number of them that are either registered, or very few of them that are registered. 58% of people are eligible to be registered and aren't, and 35% are not. And this is you can be any type of business to qualify for this: micro business, small business, women-owned or minority-owned, and there are some veteran status can qualify for this too. The primary benefit of this is an opportunity for state procurement opportunities. But I did hear today on a call with some local businesses who they are a SWAM business, they feel very strongly they could check off that box. They were a SWAM certified business. It helped them with other state funding and the PPP loan and EIDL loan just by having that category checked off on their box. So we've made an opportunity to these 58 people who are businesses who are eligible but not registered to help them get through that process, and we're certainly willing to do that. No one's reached out back to us, but we're willing to do that. Very difficult to put a map of the city on a small screen and be able to read it, but you look for the red dots. Those where the businesses are located. So as you can see, they are pretty well concentrated across the business areas of the city. Quickly moving into the recovery piece, we're continuing our efforts on communicating everything that we can find out about it. We post it up on our website. We have run several programs, primarily for the downtown area, to drive traffic. So we did a summer sidewalk sale, Shop Small Saturday, which is the Saturday after Thanksgiving, Thursdays, kind of went from Saturday into Christmas. And we started off over the summer with Wake Up Waynesboro with the virtual scavenger hunt bingo card idea. Education, we rely heavily on our partners to help educate our businesses, from the Chamber, the Small Business Development Center, Community Foundation, and Stanton Creative Community Fund. On the tourism piece, we could spend the whole session on different things that we're doing on tourism. Important to note that the city received $30,000 in grant funds from Virginia Tourism Corporation, and GARC, which is Augusta, Stanton, and Waynesboro, received $50,000 of Go Virginia money, which is the very first tourism effort to receive any kind of Go Virginia money, to help promote the area. A couple of programs, the $50,000 for GARC is a 3-phase program to buy local, to stay at home and do different things at home. That'll launch in February. And then over the summer, we'll be launching a video series. Shenandoah Valley Tourism Partnership, who we were actively involved with, has started a campaign that we'll be waiting for you. So when we open, we have all these different things to do. So all different types of things to help be ready on the tourism piece. Lastly, we were able to get some additional resources to help us plan for the future. So we subscribed to a piece of research to help us diversify our industry base. We can look for companies that are in growth modes and might need some other things that we offer. We've done a retail analysis to show our leakage of retail growth and opportunities to target specific types of retail to help balance that out. And we did a video series on East Main Street to show the organic growth and the recovery of 3 businesses as they survived and recovered through COVID. And finally, lastly, entrepreneurship, development. Again, we're not going to look at this whole big chart, but the important thing to know is the 3 squares in the middle, that we are partners on 3 different programs to help train entrepreneurs to get to the next level of their business. So we can't do all that stuff on our own, but we partner with our neighbors. Mostly these are neighbors in the Shenandoah Valley to help provide common services. Waynesboro at Work is a continuation of a Grow Waynesboro program that we started 3 or 4 years ago, where we interview entrepreneurs and publish that interview in terms of a blog on our website. We've expanded that and branded it called Waynesboro at Work, where we now publish that blog, and it's also a monthly podcast. So we've got 3 of those in the can. We have them planned for the next 1 per month for the next 9 months. So look at the link at the end of our presentation and go check out those podcasts. So it's a diversity of entrepreneurs, asking them about their success, and offers them encouragement for other entrepreneurs, and gives an example of how they can be resilient in what they do. Real quickly dive into what we're doing on the business attraction and marketing side, technology zone, our industrial park that's coming online, and some collateral. You may remember that well over a year ago, you approved a technology zone. So there are 3 sections of our city that if you have a certain type of business and you locate there and you hire the right number of people, etc., you can get some pretty significant incentives to locate there. We were all set to launch this a year ago, put everything on hold. We are now launching it now. A couple of the things I'm going to show you happened last week. A couple of things happened today. and we're continuing on over the next couple of months. So we created this landing page that click to expand is our name that we're calling everything we're doing for technology. So if you click on the landing page as you come through here, you will get a little video showing about technology, some of the things that we're doing here. We also are incorporating our Waynesboro at work. So half of our entrepreneur interviews are with technology-based companies, and the other half are with non-technology-based companies. So we're integrating the Waynesboro at work along with our technology zone. These are 11 by 6 postcards, a series of 4 of them that we're direct mailing to site location consultants. Each one is a little bit different, carrying the same theme. The first ones will go out later this week. We've running this half-page ad in an economic development journal that's focusing on data centers. And in addition to this ad, we have an advertorial in that same section of the magazine. Last week, we sponsored this newsletter in another economic development journal. We're using the tagline "Prime for Business Opportunity" in addition to "Click to Expand." And our collateral material, which I think you each received a set of these. So we created 5 industry-specific pieces of collateral plus an opportunity zone prospectus that all fits into the same family. Each one of them has these same attributes as part of what's included in that. So there you have, extremely quickly, some things that we're doing, historic look of our COVID and CARES response, and some new things that we're just launching just now. And there's a QR code. The only way you can get to that particular page on our website is through that link or that QR code. So please, if you have an opportunity to take a look at it, check out the videos, and please let us know what you think. Be happy to address any questions that you might have time for.
Anyone have any questions or comments for Mr. Hitchens?
Greg, I just want to offer that's a great presentation, a great overview. I appreciate that. One point of clarification, only because I know in the past I've gotten a phone call or email afterwards related to the downtown programming. So sort of like the bingo card and the like. Just for clarity, for the record, that was in conjunction with a non-for-profit that exists downtown, made up of volunteers that sort of champion that. We're helping to facilitate that, but they're driving the ship there, and I just wanted to.
They funded it, yes, sir.
Okay, thank you.
Yep. Mm-hmm.
Thank you.
Well, Mr. Hitchens, it sounds like you did a wonderful job presenting tonight because no one has questions. So I appreciate all the hard work you folks are doing over there.
Thank you.
Thank you very much. All right, that was for an informational only session. The next brings us to item number 9, which is to receive a report from Gary Kreitzer, the Director of Emergency Management, regarding updates on the Stanton-Augusta-Waynesboro Emergency Operation Plan and consider approving the updates by a resolution. Mr. Gary Kreitzer, step up to the plate.
Mr. Mayor, members of council, thank you very much for allowing me an opportunity to talk with you this evening. I believe you've received some materials ahead of time from Mr. Hamp to prepare you for any questions that you might have. We are required by the Department of Emergency Management and the Federal Emergency Management Agency to maintain an emergency operations plan. For years, our plans in the region were independent. It's probably been almost 10 years ago now that we decided to merge our plans into one regional plan with community-specific annexes. This isn't an end-all, be-all plan. It's a guidance document that leads us through management of major emergencies, and each time when it's revised, new guidance from FEMA and from the Department of Emergency Management gets added. For example, over the years, we've added annexes for terrorism, and for other types of natural and man-made disasters. The plan gets reviewed and revised every 5 years. It's done through my office, through my counterpart's office in Stanton and Augusta, along with assistance from the Central Shenandoah Planning District Commission, who does the majority of the legwork, putting the plan together, making sure that we've got all the new annexes from the state, and providing updates. I did notice, I'm not sure which copy, if it came off of the W drive, I noticed a few minutes ago, just going back through it, that there was a page or two at the end that looks like it got copied by mistake. It has some old business names and such in it, which I can go back and I'll correct that tomorrow. That shouldn't impede us from being able to approve that. I don't know how that got in there, but I'll take care of correcting that first thing in the morning. But again, it is a standard revision. It's been comprehensively reviewed and revised by the 3 jurisdictions. And to complete the process, all 3 of the jurisdictions are required to adopt the revision by resolution. Are there any questions?
No, sir. Thank you very much for the update, Gary. This is a action item, so do we have a motion to adopt the resolution approving the updated SAW Regional EPO?
I can make that motion.
I'll second.
Dr. Hossetter's got the motion. Mr. Allen's got the second. Any discussion? All in favor, say aye.
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 Any opposed? This motion carries 5-0. Thank you, Gary, for your hard work and dedication to the city. And we appreciate the update, sir.
Thanks, Gary.
Thank you, Mr. Mayor, members of council.
All right. This brings us to item number 10, which is communications, correspondence, and calendar matters. Mr. Ham.
Yes, sir. I have one item this evening that's a polite reminder that we have a work session scheduled for February 17th at 6 p.m. We'll be in a Zoom environment, and I think we're going to focus on revenues at that time.
Thank you, Mr. Hamp. That brings us to item number 11, which is the citizen comment period. And Mr. Hamp's going to put the number and information on the screen. I'll read it. But before we go to citizen comment, I just wanted to make a quick statement here about some letters and emails that we've received. City Council, the city has received numerous emails over the last few weeks, giving us comment and expressing concerns and opposition over the Middle River Regional Jail. This evening, I want to stress to that the City Council has not communicated a position regarding the expansion, nor has the Regional Jail Authority. The City Council receives input from the citizens, consider relevant data, and will evaluate all possible solutions going forward. But at this time, there's nothing going to happen on the regional jail, and we'll just keep collecting data at this point. That said, I will open up the citizen comment period. If you want to make a comment, call 844-844-9200. The meeting access code is 398145, followed by the pound sign. Press *6. You will hear a Q&A session has started. To make a citizen comment, you'll press 1, and you'll be prompted when you can enter the room. Again, there's a 4-minute time limit on comments. So if you would please keep your comments to 4 minutes or less, we'd appreciate it. Comment period is open.
We do not have anyone in the queue at the moment.
Okay. With that, we'll move on to item number 13, which is to adjourn. Is there a motion to adjourn this meeting?
I'll make that motion.
Thank you, Mr. Allen. Is there a second?
No.
Thank you, Ms. Williams.
Any comment or discussion? All in favor say aye.
Aye.
Any opposed? Motion carries 5-0. Everybody have a great 2 weeks, and we'll see you in 2 weeks for the next meeting.
Thank you.